My name's Alistair. I'm a final year medical student.
Hi Alistair, thank you for agreeing to speak to us today. Would it be okay if I ask you some questions about GP practice?
Of course.
Could you tell me, what does a bad day look like for a medical student at a GP surgery?
So, a bad day is one where you turn up and the practice staff aren't expecting you. In the worst case, the doctor that you were expecting to spend time with isn't there. Or all the doctors, none of them were expecting you, and they're just too busy to take you aside at moments and actually talk you through their reasoning.
Okay. And what could the practice do to turn that around? How could they turn your bad day into a good day?
So in terms of what the staff other than doctors can do, a big thing is just being warm and welcoming, and
Yes.
being a little bit organised in advance, and knowing that the students are coming is always handy, and making sure that all the practical things are in place. So in particular, access to medical record systems is really useful.
Okay, fantastic. So in terms of induction, what kind of things would you expect on your first morning?
So to be introduced to at least the people that you're going to be interacting with, ideally everyone, just so that you feel part of the surgery, is always nice. And they're being shown round so you know that where everything is always good.
That's good. So if your GP did turn up or was going to be in late, what kind of things could you learn from the non-clinical staff on reception and the practice manager that would be really useful?
So for reception staff, if a clinic needs to be cancelled, which would be a big reason to end up spending time with the reception staff,
Yeah.
helping the reception staff to phone up those patients to cancel the clinics would be quite a useful experience, just in terms of communicating that. It's a skill that we just don't develop.
Yeah.
It would be a nice way to work on communication skills.
Okay, yeah.
And just learning how all the communication happens between the surgery and hospitals, or surgery and patients, and how everything links up, because that's always a bit of a mystery.
Okay, yeah, that's good.
And for practice managers, it'd be quite interesting for us to just understand how the funding works for a GP surgery, because it's something that we've never had any idea about.
Yeah. So some of the business bits.
Yeah.
Okay. And obviously one of the things that might happen under those circumstances is that you will get a nurse clinic, maybe for a day, and you might get offered a nurse clinic anyway, and how helpful those are can be a little bit variable. What kind of things do you want in a nurse clinic? What do you want to get out of it? What would you like to do?
So I've been in a lot of nurse clinics where the appointment's quite short and practical things happen, procedures are performed, and then that's it. And they're really useful if you can do those things, so give injections, take blood, do asthma checks. Whereas if you're just sat there watching them and it's something that you could do, that always feels like a bit of a waste of time. So
Yes.
just doing those things.
So doing rather than observing, because with nursing students, the emphasis is on them observing initially and not doing. But with medical students, I think the emphasis is different. It is on doing and not watching. Okay, that's good. And what other things could nurses do to get you involved in their clinics?
Particularly with nurse prescribers who run clinics a bit more like a GP does, there's scope to run that exactly the same as a GP would run their clinic, with moments for the students to do bits of history taking, do bits of examination, talk about what they're thinking in terms of diagnosis and what the next steps should be for a management plan, and just linking all that up together and getting the students to contribute what they think along the way.
Yes.
Or that might not be appropriate in certain situations, but taking time afterwards to just talk through what happened so that the student understands.
So it's important then for the practice manager and the reception staff if a nurse has got a medical student, to allow time within their clinic for them to do that, isn't it?
Yeah, it becomes a lot easier if there's space within the appointment schedule to take a few minutes out to do that.
Okay. So when you've sat in with nurses and really enjoyed the clinics and found them beneficial, is it those kinds of things that you are doing?
So it's either doing practical things with a normal nurse clinic or getting involved in history taking and diagnosis and forming a management plan with a nurse practitioner.
Yes, okay. So in terms of feedback and how you like to receive your feedback and how that's most helpful, if you were receiving feedback from either the GP or the nurses or the reception or practice manager, how do you like to receive your feedback?
So I think verbal feedback is the best because it's the simplest, and one of the most useful, one of the ways to make feedback good is for it to be prompt, and obviously verbal feedback happens instantly, so ticks that box. It needs to be specific, so addressing particular points rather than just saying, yeah, that was good or it wasn't so good. If there are particular details that either were good and should be continued or aren't so good and need changing,
Yes.
then that works. And it's as simple as that.
Okay. Alistair, thank you very much for your time.
Thank you.